I suggest that you restart your computer after this lecture.
I will again. I work on a Mac.
You
I
tried
think
that?
it started recording now.
Okay, so now we're recording,
Yeah.
and I have to be honest. It really is. I think the system at the university. I think they have too many of us using bandwidth across that platform because over the summer, while I was teaching the classes online in the summer, we had no problems. I was one of the few people doing live lectures. So I do have a feeling it has to do with the connection through. Um, what I want to do is, as you can see, this is our syllabus. I did not talk about this in our first lecture on Monday. I do want to remind everybody, if you look here, our class is from 9 to 10 on Monday and today from 10 to 11. I know that's confusing. I have no idea why they did it that way. But it is that way. And the alternate times, you should have health economics, if I understand correctly. Okay?
Doctor,
Yes.
are you recording the lecture?
Yes.
Okay, thank you.
You're welcome. Okay. Now, as you will also see down here, it says office hours. And I'm kind of circling around this right now. It says by appointment in 8 to 10 on Tuesdays and Wednesdays. That is that link that I have given you. So in other words, let's say you have a question about today's class. You can always send me an email or a message, and I will get to those usually within about 24 hours. But let's say we had office hours tomorrow morning. You might instead want to go, oh, I'll ask her in person. So you can join the team and you can use the call feature. You can use the video. And that way we can quickly talk and I can address your questions. Yesterday, a lot of you wanted to have a discussion, and I'm happy. And I was so amazed at the questions that were asked and everything else. It is strictly a chance for you all to ask questions. You don't need to log in and just be silent, because when you log in and are not asking questions, it doesn't free, it's like it would be like somebody sitting in your office and just sitting there watching you work. Okay? So I just want to kind of explain that office hours are a chance for you to come in. I will talk to you all you want in that time. Okay? So you can use the different features. Obviously, here is my email. You can always email me. And as I scroll down, what you see is it talks about your reading materials and video links. In your class materials, you have your lectures and you have the PDF files of each of these reading assignments. The Department of Statistics from the Jordan population, the WHO Jordan Health Profile, and just this year's release on the SDGs. All of those that I will show you again are in there. There are also links here to various YouTube videos that I use, okay? Besides the ones that are embedded in your lecture. This is just another way to define it. I'm not going to read through the course description and objectives, but this tells you what you should expect will be covered in the class and what you're expected to be able to do by the end of the class. Okay? Our teaching methods, unfortunately, are lecture because you're such a large group. And as you will see, if you keep scrolling down, every week is the topic. So this week, we're doing units 1 and 2. I have to be honest, we're only getting through unit 1 today. Okay? Next week, and it tells you which lecture notes are the unit and what to read out of those PDF files. The WHO Health Profile, pages 3 through 18 for next week. So you will see these linked all the way through. You know what we're going to be talking about, what you need to have read, and what we will be discussing in class. Okay? The exams. They have changed the policy this semester. Because we are online, usually we had 2 class exams and a final. I am being told we are having one midterm and one final, so each will be 50% of the grade. Just so you know, and I don't know how they're going to format that or anything else, even if they're on campus, they are electronic. And I'm just seeing my little windows scroll. Honest, I'm sorry, guys. It's just that slow. But the exams are 5-item multiple choice. I do need to tell you, if you miss an exam, hear me loud and hear me clear. If you miss an exam, the makeup exam is given at my discretion. You must turn in a medical excuse within 72 hours to the secretary at the university, and it will be all essay. Okay? So I just want but the syllabus is here. It's in your folder. I still can't even make it stop spinning. So I wanted you to see that. Now, what I want to do is we'll hide that screen, hopefully. Boy, this is amazing. Everything is just frozen. I'm waiting patiently. Okay. Now, I'm waiting for it to give me the option to share our presentation. I'm not even going to try to share the screen of the health policy team right now. There's just no way it's going to move through. Everything is moving too slow. Okay, come on. Give me some options here. Okay, let it share my PowerPoint. Now, yes, on Monday, what we were talking about is we were talking about COVID and COVID-19's health policies. So what I want to do is I want to go ahead and start back on that, and we will get through these slides today. I've had several of you ask me questions about, do I need to memorize these numbers? Guys, first of all, if you need to memorize a number, I will tell you. What I usually do.
I need to get out from the lecture and return back and get back.
You can always leave and come back.
Okay, thank you.
Now you should see on the screen, hopefully, I'm hoping, the policy piece that talks about Jordan's policies, and this was from the MOH website, okay? If you look at this, obviously part of it is in Arabic, which, as you all have figured out, I cannot read, but it's the ranking of the different levels of kind of a warning policy of, if we have this, we're at green. What does green mean? For most of us, we think of traffic signals. Green means all's good, so we're at a go situation, okay? If we're at the blue, warning, yellow, we are somewhere between orange and red at this point, okay? What they talk about, and they used to post up here, was the curfew hours. It talks about transportation. In other words, buses and other things can only move at 50% occupancy. Social gatherings are limited. Mobility within the governments is permitted. In other words, you can go from Irbid to Zarqa to Amman, things like that. So they created a site that was designed to kind of show these pieces very quickly that people could get access to. Now, what I do want to do is I want to now talk about, we had talked about kind of what was happening and the numbers in Jordan and the trends we saw were going up. I can tell you that just since our class on Monday, do you remember on Monday I talked about on the 7th, there were 100 plus deaths. By Monday, there were 177. This morning, and you all can't see my little window, but I took some notes this morning very quickly, and I'm just going to pull, hopefully it's going to pop up, so will let me read my numbers. As of this morning, there were 28,127 COVID cases in Jordan. Okay? There were 6,361 recovered. So that tells you what? There are about 22,000 active cases that they know of. There are cases that they obviously do not know about. Now, the interesting thing is the deaths. That 110, 177, as of this morning, there were 225. So just in 2 days since our last class, there have been almost 50 COVID deaths. That starts to change policy. What I did, and we're going to learn how to do this later, is I calculated a term, and you're going to learn this term. And like I said, you're going to learn how to calculate these in a couple presentations forward. There's a term called case fatality. Fatality obviously means death. Okay? Case fatality, what we do is we take the number of deaths from a disease over the number of people with that disease. So we're trying to find out the percentage of people that are dying from it. With Ebola, we have a case fatality that's closer to 90%. Okay? When I did the math here, I took 225 deaths over the 28,127 cases. When I did the math, it comes out to 0.8%, almost 1%. You go, okay, not a big deal. Not very many, less than 1% are dying from it. Let's not worry about it. The problem is we can start to now compare Jordan's numbers to other numbers in the world. In other words, you all asked me, some of you in the question and answer session yesterday in office hours, asked me about healthcare systems and which ones I liked and what I thought was better for treatment and things like that. On countries that have even had high numbers, case fatality ideally should be less than 0.5%. If they have really good treatment structure. What this starts to say is that Jordan has more people dying of COVID here than we have people dying of COVID in another country, in the average other country. So that starts to, again, affect health policy. So if you're looking at this slide, why I say, would you do things differently? These are actual articles, and you can see dates and times, okay, where they start to identify different things about COVID. What they've started to identify is there's a certain possibly DNA link, okay, and it talks about 2 spots in the human genome, which is DNA, that make one at increased risk for respiratory failure. Part of that is your blood type. And what they've started to find is people with A-type blood are more likely to need oxygen or go on a ventilator, okay? So if you're O positive or O negative, it doesn't mean that you won't get sick from it. What it does say is if you have A blood, you are more likely to have an increased risk of needing oxygen. If we need oxygen, does that mean that you're likely to have a worse outcome? Absolutely. So we start to identify that. Interestingly enough, if you're from this part of the world, it's very likely you have a higher percentage of population that has a blood type. So does that change how you think about policy? Okay. What about these recent results? And these were published by the CDC, and you can tell it's copied and pasted right in. As I mentioned in class on Monday, what we found is there are 2 things specifically that actually increase the likelihood. We found that were different between those that were COVID positive and those that weren't. And what we found is that those that were COVID positive, okay, 42% reported having close contact with somebody who had COVID-19. In other words, they knew of somebody having it, and out of that, 51% were family members. So they knew they had a cousin, an aunt, an uncle, a mother, a father, a brother, a sister. Somebody in their family was more likely COVID positive. Again, remember time and duration. That makes sense. The other really big thing was and I alluded to this the other day, is you were 2.4 times more likely to have COVID if in the last 2 weeks you have gone out to eat. Notice when they talk about sitting at a restaurant, it includes being seated outside, on a patio, or being seated inside a restaurant. That's 2.4 times more likely. That's more than double, almost 2.4, 2.5 times more likely. Okay? Does that change your feeling about whether we should have restaurants open for people to sit at or not? Okay? These are statistics we start to look at. So when they create policies, they're thinking, how do we curb these two behaviors, which are the behaviors that are most at risk? Okay? Here's the problem. Jordan doesn't rank very highly in the world for being able to deal with COVID-19. I know one of you yesterday asked me or made a comment that you really, actually it wasn't asked me, it was somebody said, we did so good, and I can't remember who you were, and I apologize. You said, we did so good at the beginning with our policies, and then they just disappeared almost. And I was like, yes, that's exactly how I feel. Well, it is how I feel. And the thing is that Jordan doesn't have enough hospital beds. It doesn't have enough ventilators. It doesn't have enough high intensity trauma care. In other words, when we need really good critical care ICU components, Jordan is a small country with small resources. That is why Jordan ranks so low, because you can read this article and you can see that they rank other Arab countries like the UAE and Saudi Arabia on a global scale. I've got to be honest, the UAE has about 10 million people. Jordan has about 10 million people. The UAE has a whole lot more money. So does Saudi Arabia, so does Bahrain. What does that mean? Well, I can talk about the UAE specifically because we have Harvard medical facilities there in Dubai. We have Cleveland Clinic and NYU in Abu Dhabi. They have some of the best medical treatments and facilities in the world now that are linked with the top medical facilities out of the US. That means that what? They have the beds, they have the money, they have the infrastructure, they have the nurses and the doctors that can take care of this better than we can here, because the numbers in the UAE, I've got to be honest, they have more COVID cases, but they're ranked much better. Number 9 globally on being able to deal with COVID. Okay? Somebody asked about China, and we talked about the China policy. Remember, they had the few new cases this past week in one of the provinces. Yesterday, in one day in that province, they closed the whole province down. The goal is to test the 9 million residents. They tested 7.5 million people yesterday for COVID in that county, in that region. Okay, they almost in one day. That's almost the whole population of Jordan. In one day, they tested all of them. Okay, this is why testing and containing, when we talk about population samples, becomes really important with policy. But you have to do it fast. You have to know the results fast. If I give you a test for COVID, but I can't tell you whether it's positive or negative for 5 or 6 days, is that helpful in controlling the spread of COVID? No. Because what? If you go out and you're still seeing other people, those 5 or 6 days, you're spreading the virus then to other people before you know if you have it or not. So we have to think about what can Jordan do differently. I thought this was interesting because what they have started to find is when they do studies across the board and they're looking at COVID so inclusively, is that societies that are inclusive, tolerant, and better educated are better able to manage the pandemic. In other words, they're more accepting of things. They're accepting of wearing a mask. They think it's important. They understand it and they value it themselves. They're not being told you have to do this. Okay? And I think that's very interesting. The other piece is the education component. If you understand how COVID spreads, you're more likely to do the things that will help reduce it. With the poll that you all took, thank you for all of you who took my survey the other day on what you thought about COVID. As you saw in the class, I posted the results. But what I thought was really interesting, and maybe we'll talk about this on another day, is some of you talked about wearing masks and some of you talked about herd immunity and lots of different ideas. But I found it really interesting. Some of you talked about wearing gloves. Well, there's no studies out that show that wearing gloves reduces the risk of COVID. And the reason being is we wear gloves for very different reasons. If you go in and you wear gloves everywhere, your gloves are just like your hands. You've touched this, you've touched that, you've touched something else. All of that, and then if you take your gloves and you pick up your phone, okay, you have just contaminated your phone. You put your phone to your face. All of a sudden, you have now made contact with your face, which is the ideal place you don't want your hands to be. Wearing gloves is not the key. Having clean hands is the key. I actually, when this first started, did an in-service with faculty because I went to the bank one day and was mystified as I watched the little girls at the bank, and they literally put hand sanitizer on top of their gloves, picked up their phones, are handing everything back and forth, and they might as well have not been wearing gloves because the gloves, first of all, you don't put hand sanitizer on top of gloves. That totally defeats the purpose and is not a safe thing to do. But second of all, what they needed to be doing was every time they touch a new surface, once you leave someplace, I go to the grocery store. I sanitize my hands before I go to the grocery store. I do my shopping. I pick up things only that I really need. And when I leave the grocery store, before I get into my car, I put hand sanitizer on again. That way I'm not taking the germs from the grocery store into my car. Does that make sense? You following? So we've got different things.
Yes,
Yes.
it does make sense.
Yeah, doctor.
Talking about
It does.
cleaning your, I have to be honest, not only do I have that, I have a package of like Clorox wipes in my car. So in my glove compartment, I can take out the wipes and I can wipe down my steering wheel and my dash every time. I drive around my car without my mask, without gloves, without anything because it's a clean car. Okay? And stuff. So there are different policies that really need to be explained. Now, when we talk about policy failures, and some of you asked me about the United States, like I said, it has been abysmal. These are just two posted events of this past week.
Doctor,
Most of you may be aware that we think Donald Trump, our president, was actually a super spreader, that he is responsible actually for more than 37 cases in the White House, and something they've done with policy. The Centers for Disease Control, which is the CDC, the same way you all have the policy here, only 50% of the seats can be filled on a bus. Everybody must wear a mask on the bus. What they did was they said, guess what? We will not require people to wear a mask on any public transportation. How safe would you feel getting into any taxi, any bus, any subway, any type of mass transit, getting on a plane and not having people wear masks?
I won't feel safe at all.
You don't want to do that, do you? Yeah, and
I
so
don't.
it's interesting.
No, we don't.
Well,
But
hopefully not.
doctor,
We're children
No,
are
we
going,
don't.
we're all trying. But ideally, if you really think about it, and this is a huge failure again, and this is political. Notice it says the White House blocked our government's public health agency from saying, guess what? You need to wear a mask when you're on public transportation. I can choose in my restaurant or my business to say, yes, you can come in, or no, you can't if you have a mask on. But these are government operated things, so they have to have a government mandate. Okay, so these are examples of huge failures. If they're going to let everybody just go how they want to go, some people aren't going to do it. Do we really know? And so let's talk about now, the last thing I kind of want to talk about today is mortality rates. We're going to come back and look at these slides again when we start talking about how to calculate that case fatality, general mortality, PMR, proportionate mortality ratios. There are about 4 or 5 numbers we really look at when we talk about mortality rates. Mortality, I know for some of you this is the first time you may be hearing it. Mortality means death.
Yes.
Okay? Morbidity means sick.
yes.
So we're talking strictly right now about death rates, okay? People that die. And this is an older picture, but what I want you to see, and there are no numbers here, so this gets pretty easy. Each is a country, okay? The blue line, when we go
Doctor.
back historically, yes?
Doctor, may I ask?
Yeah.
What does mean of mortality in the previous slide?
Mortality means death.
In large scales, yeah?
It
Death?
can be,
Numbers of death.
mortality is just
Numbers-
another word for death. Somebody,
Numbers
remember,
of death?
mortality is death. We are, and here's a way to remember it. In English, you can talk about the word people, human beings are mortal. When we say human beings are mortal, it means that we will live and we will die. We are not going to live forever. We are mortal. Mortality is death.
Go to graves, yeah?
Yes, die. Yes.
Thank
Doctor?
you, Doctor.
Yeah.
Do you think that the health sector in Jordan will collapse like what happened in Italy months ago?
That's the big fear right now. That is a huge fear. And you're absolutely understanding what we're doing, what's going on. Yesterday, what were the cases? Over 2,000 reported cases. Now remember, and I know when I was talking to some of you that were asking questions in the office hours. So for those of you that didn't hear this, what I want to say is, what do I want to say? When we look at these rates, Jordan does not have the infrastructure to really handle these numbers. Yesterday, with the numbers being over 2,000, that doesn't mean we've caught all the cases. Those are just the ones that have been what we call contact tracing. Okay? That means that they knew somebody that had COVID. What happens is we have people that are epidemiologists, and when somebody tests positive, they meet with that person and they say, where all did you go? Who all did you see? How long did you see them for? And that person then goes out and tries to find all the people they came in contact with. That's why it's called contact tracing. When they find them, they test them. So the numbers we're getting are strictly from people that have been exposed that they know about, not people that we don't know about. So the number in Jordan is much higher probably than it is. And you go, but how can you guess that, Dr. Harvey? Well, or Dr. Heather, I can guess that because we look at the percentages of of people that test positive when we test them. If we're trying to estimate how much is in the population, the test we give should be less than 5% should be positive if it's representative of the community. What I do know about Jordan is the percentage that are being tested right now, you are way over that 5%. So if you're over that 5%, it means that there are a lot of cases we're not finding. Okay?
Doctor,
Yeah? Yeah.
why did the government stop education only?
Well, it's one of the few places where we know we cannot contain it. In other words, I can't sit, and remember we talked about time and exposure risk yesterday. We can't put people in large rooms together for extended periods of time and have them talk. Whether you're sitting there or not, it's just, and the thing is what they did in the United States with some colleges, and remember, there, students live on campus, or most do, okay? And what they've done is they've made it like a bubble. So they've made all the students live on campus, and they all are tested regularly, and they all stay together. In Jordan, you all come from all different places and go home to different places. The result is we don't have that containment. So I can't have classes with students coming from Karak and Irbid and Zarqa and Amman and all the different provinces, driving in every day and then going back to their own states every day, because if they're exposed to one person in your class is positive, all of a sudden everybody in all those states has to be traced and found. You start to realize how it becomes almost impossible.
What?
Okay. Does that start?
But the same thing happened in
starts to
restaurants
explain.
and other places.
Yeah. So, but let me stop there because I really want to show you this. Okay, this is on deaths. And what I want you to look at is, like I said, you don't need numbers here. You're just looking at the maps. You see a blue line for every country and you see a red line. The blue line is when we go back over history of years and years. The blue line is the average number of deaths every month. Notice it goes from January to December. So it looks at kind of the flow of deaths in Spain over a given year. In Ecuador, this is typically about the average number. In the Netherlands, we see different changes. In Germany, what we then see, so that's what normally happens. And down here, let me just show you, here's Turkey, Istanbul, and here's New York. Normally, we see about 7,000 deaths a week, which is this blue line running all the way across, okay? Over here, we see this line. And this is the normal, the blue line is the normal number of deaths. What we now see, the red line, is how many people were dying at the beginning of the COVID infections. Between January to about April is where this stops, okay?
Doctor,
Yeah.
Doctor, is that 2,000 weekly deaths bonus or average?
It's an both of them are averages. So we can't say that these red lines are COVID deaths, but what we can say is that this year, the average number of deaths over this time spiked way high. If
Is
you
that
notice,
2,000 with COVID or without?
the red line is with COVID. The blue line is without
2,000
COVID.
weekly deaths. The number next to red line, 2,000 weekly deaths.
Yeah.
Is that with COVID or without?
That's just giving you the number. Like
With
I said,
COVID?
we don't know. And here's what I understand what you're asking. We do not, these graphs do not show us which had COVID and which didn't. What it's showing us, the blue line is how many deaths normally happen in that country every year over time. The red line is showing us this year, when we've had COVID, this is the average number of deaths we've had in France. And what you're seeing is what, for some of these countries, the number goes way up. So we can
How Turkish
assume,
and Indonesia?
hold on, let me explain it, okay?
Okay.
Before you keep jumping,
Okay,
because I
okay.
can't get through the whole explanation, and I think it will make sense.
Okay, I'm
If you
sorry.
look at this, what it's doing is saying this year, so I'm following France, this year in France, all of a sudden, the average number of deaths went way up in February and March, and then started to come down. We can safely assume the difference in deaths may be COVID related. Does that make so? The red line is showing us the difference. Notice that in the Netherlands, there was no real difference there was actually lower deaths in the early part of the year, and then all of a sudden they went up. In a country like Norway, interestingly enough, and even in Denmark, if you look here, guess what? There was really not a big difference. In other words, the deaths weren't different. Okay, so was COVID affecting their population? Probably not. Versus we can come down here and very quickly look at other places where it went way high really fast and go, that gap is probably related to COVID related deaths. So this is a way of being able to see, are we seeing more deaths as a result of the current disease compared to what we would expect to see any other year? Any other year, we would expect to see cardiovascular deaths, all the other pneumonia, things like that. And that's kind of what that blue line is. Now,
Doctor, what about Germany?
okay, when we look at Germany, what's interesting is actually they had lower deaths, if you notice, just a little bit lower in January and February. But what's really interesting is then if we get into like what would be around March, you start to see what? It was starting to go up. This only covers the first couple of months of the year. It doesn't cover the whole year. Obviously, that's why the line stopped. But we started, and Germany, once they started to see this, immediately put down policy to change that line.
Doctor.
Does that make sense?
Yeah.
Doctor, I want to
Yes.
I want to ask you that do you think that prohibition is a good solution now to reduce the high number of cases?
Migration?
The prohibition.
I'm not
Maybe
sure
she means quarantine.
You mean lockdown?
Quarantine. Isolation. Ah, not migration. Isolation. Okay. Sorry, you wrong. It has to be done for people that are exposed. And so,
Doctor,
yeah.
we need to look at all the year average, not for averages.
And that's what the blue line is multiple year averages. If you notice, and this is the next slide, so that gets to this point. This one just starts to look at 3 countries. Sweden, where there was no lockdown. Norway, where there was a national lockdown that started on March 12th. And Denmark, where there was a lockdown starting on March 11th. Okay? What they started to see was, notice here, all the blue and the other, these are the average weekly deaths, all these little lines, for 5 years, from 2015, 16, 17, 18, 19, 4 years, sorry. Okay? Then the red line is this year's. What do we see? But there was no lockdown. Now remember, Sweden is the only country that said we're going to try herd immunity. Notice what happened very quickly with herd immunity. Their death rate went really high, really fast. But then it started to come down as more and more people either die or get the disease. That's exactly what they talked about when we looked at the slide that said rush through things. Okay? We come over here to lockdowns, and notice what happens. When we have a lockdown, our death rates do not change dramatically. They stay stay pretty much in line with keeping the death rates at the normal level, which means our health systems can work. So you're making two different choices. And to the one of you that just asked a minute ago, just about this is, you said, does isolation or lockdown work? Well, here's your answer. Okay? It may not be, but it stops the economy. So again, health policy, we're trying to figure out how do we put all this together. Okay? Now, I know we're almost through time. I want to finish these slides, and it's 10:44. So give me about 5 minutes. I can then stay and answer some questions, but I want to try to end close to time, and I also want to get through this material. Again, please do not email me and say, do I need to memorize these? No. What I'm wanting you to see here is, even when we look at comparisons of mortality rates, it's the country versus the major city. So in France, the mortality rates average was here, but in Paris it was much higher. Notice for England, London is higher. For New York, for Spain. So the numbers we see that are very high in Oman are very normal, because when we have a society with lots of people in it, and Oman is your major capital, where most of the people live, we're going to have higher death rates and higher case rates in Oman than we are in other places. So this just is trying to explain that we expect that there will be more deaths in Oman than there are going to be from Zarqa or Erbil or Aqaba. Okay? We just can look at this, compare it to other cities. This,
Doctor,
I think, is... Okay. Guys,
may I ask?
please, you can ask at the end, okay? Give me 5 minutes, because I really do need to get through these slides, and then you can ask, okay?
Okay, I'm pairing with you.
Oh, thank you. Okay, so over here, this is, again, remember I talked about being 2.5 times more likely to have COVID if you're using the same kind of numbers. It's what we call a relative risk, or an odds ratio. And this compares deaths with other types of diseases. So coronavirus, they were 4 times more likely to die of coronavirus in Peru. In New York City, when the outbreak started, you were 5.8 times more likely to die. They compare this to other things. You hear President Trump and other people, the president of Brazil, certain other political people, say, COVID is just like the flu. And yesterday we were talking about, some of us were talking about conspiracy theories. Well, let me tell you this. A bad flu season, 1.5 times. So 1 times anything is itself. Does the flu increase the risk of death in New York? No. But coronavirus, 5.8 times. If we're talking about natural disasters, like a hurricane, they compare it, you're 2.4 times more likely to have died from Katrina versus, again, these huge numbers for coronavirus. Even 100 years ago, which was our last major pandemic with the Spanish flu of 1918, 7.3 times. So we're not quite as high as what we were at a pandemic 100 years ago, but we're getting close now. So this compares it to other events. So when people say coronavirus, it's normal. It's not anything worse. Well, we can compare it to other events, and we can show you that generally, yes, it is worse. Okay? The other thing that has happened, and this is good news in some ways, is that this is talking about mortality rates. And here we start to, and notice what happens. If we look across the world, March, April, May, lots of people dying. And then as summer came, it went down, and now it's starting. What's the problem? Is now it's starting to go back up again. Okay? What we did was, one, being outside reduces the risk. But now as we come back in, as winter approaches, people are more in confined spaces. The other thing is, when it first started, we didn't know what to do to treat these people. We are better at treating the symptoms. Not curing the disease, but we are better at treating the symptoms. If we're better at treating the symptoms, the likelihood of survival will increase. So we're seeing a decrease in deaths related to complications from the disease. However, the number of cases is now starting to go back up. Okay, a couple more slides. So what I want you to think about between now and next week, there are a couple of different things I'm going to ask you about. Okay, one is to think about, what if we had another outbreak of another really infectious disease like Ebola? And this is exactly what started to happen in June. All of a sudden, Ebola comes along and starts again. So not only are they dealing with COVID, but now we've got Ebola. So what do we do with our health systems, and where do we focus? We know there's higher case fatality, but Ebola spreads by bloodborne pathogen versus respiratory. What are all the things we're going to have to do? So we look at this and go, oh no, now we have another health crisis in our community. How can we deal with both of those with medical care? Okay. The other thing that happens is once we tax out the system and everybody is taking care of COVID patients, we don't have people to take care of the normal diseases. And this gives you an idea. This was traced over the US. Notice in the 10 weeks where the COVID outbreaks really started, people that went to the emergency room for heart attacks, down by 23%. It did not. Stroke, down by 10%. Having diabetes and it being out of control, down by 10%, 20%, 10%. It doesn't mean that the cases decreased. It means that people stopped going to the hospital to get them taken care of because they couldn't have access. Okay? So how do we make sure that there's also the concern with children. What we've now found out is that children aren't getting immunized for their other health issues because parents are afraid to take them to the doctor to go get their immunizations because they don't want them exposed. Okay? Can you build a policy on hope? I wish we had 5 minutes to watch this. The other part of your homework assignment is to come back to this slide, watch the first 5 minutes. Okay? Now, I can guarantee you, if you think you're going to pass my class and you do not know the 3 criteria for a pandemic, and we are living through one, you should fail my course. It doesn't sound nice, but I promise you, you should understand what are the 3 criteria for a pandemic. One is it's deadly. Okay? Number 2, it mutates and migrates. In other words, it spreads from person to person. Well, by mutate and migrate. And the disease itself changes. It becomes, the virus or the bacteria adjusts so it can spread easier, or it can be more infectious, or it can be more deadly. It learns to survive better with every replication. That's the migrates and mutates. The other thing is it spreads from person to person. Okay? I'd like for you to think about SARS, MERS, COVID-19. They are all pandemics, but they are respiratory. Ebola was a pandemic, but it is not respiratory. HIV and AIDS was a pandemic. It is not respiratory. It can spread blood and body fluids. It can spread by other means. So it doesn't mean that it has to be airborne, okay? So that's really important that you kind of know that. This is just, again, to kind of give you a history. These are other pandemics that have happened over the last several hundred years. We look at smallpox and how many people died. Measles, okay? Cholera, Hong Kong flu, HIV and AIDS, okay? These are just the biggest pandemics before we got to COVID, okay? To kind of show you the different ones we've died from. Now, my very last slide, and then I can have questions. As we have seen in the debate about opening the economy, many questions about the so-called end are determined not by medical and public health data, but by social political processes. Okay? You all are asking, a lot of you have been asking the right questions here. I can stop sharing the screen. You are asking the right questions. But what about the health part of it? What about the economic? And this is exactly what health policy is always dealing with, is how do we find these different balances? Okay? Let me now stop. For those of you that are through, you can go. I will see you all in class on Monday at 9 o'clock. Okay? For those of you that have questions, I can stay and answer a few questions for a few more minutes. And so I will answer those questions.
Doctor.
Okay, Doctor.
Thank you, Doctor.
You're welcome. Have a nice rest of the week if I don't see you. Okay, questions.
Thank you, Doctor.
You're welcome.
دكتور
Yeah.
You have showed us statistics for the deaths by the
I
corona
can't hear
and
you
how
very
quarantine. Okay, just.
Can you speak closer or louder for me? Because I'm literally holding my ear to my computer.
Yes. You showed us some statistics
Yes.
for how quarantine are actually effective to lower the rate of
The death rate,
deaths,
yeah.
right?
Yes.
But don't you think at some point this will actually fail? Like we can, I don't know, pull it off for like 2 or 3 or 5 or 6 months maximum. But at some point it will fail because people got to do some mistakes, got to do some things that actually life has to go on. It's not an effective solution. Don't you think that?
And remember when we watched the video with I don't know if you were in class, if you had joined the class yet on Monday, but if you had,
I will.
we watched, that short video. That's exactly, and we talk about now people having what they call COVID fatigue, okay? This is exactly the type of stuff we're talking about. You can't do it forever. You can only do it for so long, and you hope that if you get the full compliance, remember that coordinate and crush is that everything stops long enough that the virus doesn't have any way to spread anywhere. If it doesn't spread anywhere, then it dies out naturally. Problem being is we don't have other countries coordinating with that. So these lockdowns only work as long as we do them. Now, the thing is you have to eventually, and that's the whole dilemma. You have to open up. You have to do certain things. But can we do them in other ways that reduce our risk? That's where the policy comes in. That's where wearing a mask. That's where washing your hands. That's where staying a social distance from each other. That's where those things become important. Does that make sense?
Yeah, it does.
Doctor?
Yeah. Yes.
Doctor?
I don't think lockdowns or herd immunity is a solution. I think following policies and vaccinated is the solution.
And wouldn't it be nice? And once we get to a vaccine, it will be lovely. The problem is we need to figure out how we live for another year or so without a vaccine. Because by the time it gets around the world and we get one that's approved and safe, it will probably be another year. So how do we make the next year work? Does that make sense? And we all are banging on a
Maybe
vaccine.
we won't have a vaccine.
And it could be we don't.
Solution.
Lots of
Should we memorize the statistics?
Wait, guys. Wait.
Again,
should we
when I
memorize
tell
the
you the
statistics?
numbers I want you to know, I tell you. I am not memorizing statistics only proves to me you can memorize. It doesn't prove you can think about it. So in other words, I'm more likely to give an exam question and go, okay, if we know these things, what do you think would be the best option based on what we've learned? Does that make sense? So I'm not going to ask you a flat out there are some memorization questions. We're interested
Our reference
in
is the slide.
Well, doctor.
Yes.
Doctor?
Our reference to study is the
Okay,
slide.
hold on, guys. Let me do hands. And let me look on the list because I've got about 15 more minutes I can do this. But let me go by hands so that way I can, because everybody's asking at once if the screen will shift to hands and show me who's showing hands. Please show me. Please.
Doctor,
Yes.
I think Germany saved its economic, and that's the point.
Pardon?
Germany.
What about Germany? Right now they have a huge problem again. Their numbers have gone up dramatically in the last 2 weeks. They're now back where zero, and they've closed down all their nightclubs as of this week. They changed their policies on public gatherings again. It's always fluid. There's this continual. They did really good. They did good at the beginning. They were good at the testing. They had the whole infrastructure, and then people stopped social distancing. People stopped wearing things as much. They started going out more. And what happens? The numbers go right back up.
Doctor?
Yeah.
Doctor, is the pandemic is deadly? I mean, corona only can kill people, or they must have respiratory disease also?
No. You do not need respiratory diseases to be a pandemic. You can be a pandemic, and it can be connected through blood. It can be spread through semen. It could be spread through. Let me give you an idea. What if we had botulism or a food outbreak? That's spread by food. It's not, but it can kill people. We still are talking about that potential if we had contaminated food across the substance. So there are other ways, and that's why I don't want you to make the mistake of a pandemic does not need to be respiratory. It just happens that respiratory is the easiest method to spread. In other words, I don't have to have physical contact with you with respiratory, which is why it spreads much faster.
Yes.
Doctor, can I ask you a question?
In your
Yes.
opinion,
My question is about the speed of transmission of virus corona.
Okay.
This virus, I know many patients of virus corona does not their wives does not have the virus, and they live in the same room. Can you explain that?
We can't explain it.
Wow.
It's kind of one of those things of, will they possibly and most likely get it at a later time? Yes, but we don't know why. So, and that's one of those things. It's almost like saying, when we look at certain families, two may be exposed to the same health issue and only one gets sick. Some of it is just luck and genetics that we don't understand yet.
Doctor,
Doctor?
in your opinion, what the benefits of inference
I have a question.
curfew 2 days only in Jordan?
What's the benefit of what in Jordan?
Of inference curfew 2 days only in Jordan.
I don't understand the question. I'm sorry.
She means quarantine for like the Friday and Saturday.
Oh,
Friday and Saturday, yeah.
that is very much about contact tracing. In other words, by shutting down on the weekend, what it does is it doesn't stop the spread of the disease. It gives enough time for the epidemiology teams to reach out to those and test those that have been exposed and see if they're positive before they go out and spread it to others. This really has to do with allowing the teams to have access to people that may have been exposed. It does very little for changing the number of, except for like making us more aware and stopping those people from then spreading it without knowing it.
Doctor, what is our reference to study the lecture?
These set of slides right now, and things like that, what we've done right now, there is not a reading per se. I do have readings that I put in the additional reading folders that are just interesting articles. Yesterday, some of the students were asking me specifically about, hold on, I'm trying to pull it up. were asking me about COVID antibody duration. Well, just literally last night, I got an article and I put that in that talks about the antibodies. And now the studies are saying 3 months is about what we know. In other words, once you've been sick, we know you're protected for at least about 3 months. But that's all we know. After 3 months, we don't have any idea. So I'm adding facts in there, like I said, to kind of help you think about that we have to be, health policy is a lot about investigation. You have to think about what are all the potential outcomes. And based on all these different outcomes, we try to choose a policy that fits and addresses different priorities at different times. So that's what we're talking about here. Okay?
Doctor, I have a
Yeah.
strange question, please.
Hold on.
We talk
about
I have a strange question, please.
Guys, I would love to, I wish I could call on you, but when I've tried to put my hand thing up, it's not giving me my list.
Okay, I have a strange question, please, right now.
Okay.
I watched both lectures. I understand everything you said, and I stand the numbers and stuff like this. But until now, I can't figure out what I should study for the exam to get a high mark.
Me too, والله.
Guys, I know you all worry about marks, but at this point, you need to worry about just understanding if you understand right now, then you're doing great. We're going to start
Like, I mean, should I?
We're going to start adding.
I understand.
Yeah.
Like, I understand what are you saying. I understand the situation, but should I return to the slides and start memorizing what you are saying and stuff like this?
With this slide, instead of the slide, I do want you to know the difference. What is a pandemic? What are the 3 criteria? What are the ways? I will try to give you more guidance when I write the exam. But I will tell you this. If students ask
Criteria.
do I need to memorize this? My answer is memorization is your way, memorize it. I do not do memorization. Okay?
It's not my way. It's not my. I don't mean that, but like, I mean, I understand everything, but it's something new. We can't know, and we can't figure out what we should study. Okay?
Yes.
I understand. At this point, the best way to prepare right now, what you need to be doing is just reading the lectures ahead of time, reading the assignments that I've assigned on the syllabus before that week. So for next week, you want to read those pages out of the Jordan Health Policy PDF. Okay? If you do that before I have class, that's what's important.
Can I ask you to do us?
Then you have at least heard
Doctor?
the words to go, oh, I don't understand this. Can you explain this? That's the best I can tell you with preparing right now. As we get closer to an exam, I will definitely try to say these things are important. The same way today, I said, this is important. There is no way I'm not asking about this. Okay?
Big thank you. God bless you.
Okay. I have time
I have a
for
question,
one more
Doctor.
question right now. What's the question?
My question would be that the textbooks that's in the syllabus, are we demanded with the content of them, and also the YouTube videos, are we demanded with the content of it?
It's what I'm teaching from. So if you don't want to read it and you don't want to know it and it's on the exam, that becomes your issue. If it's on the syllabus, I've put it there for a reason. So you read it and understand it. It is there to help you.
Yeah, but thank you, Doctor.
No,
But actually,
that's the end
I
of
wanted
that.
to ask you also, what is the additional textbooks, or there's no additional things like to know, just for information, you know, self-reading? Are there any books that self-reading?
I don't have any other assigned readings to you. You are welcome to look on things on your own.
Okay,
Can you
thank
do us something, please?
Yeah.
I didn't understand much of the lectures. Can I only adopt slides?
You can go back and watch the lectures again and again, guys. I record them. Right now, I'm trying to make it stop recording. And you can find the lectures and you can go back and listen to them slower. You can take your own notes. You all have lots of luxuries that are not normal from having a class live. So there are lots of ways you can be looking at this on a regular basis.
Can you post what do you want us to do for the next class?
It's in your syllabus. It's already posted.
No, what do you want us to do?
No, I'm not your mother and I'm not your babysitter. You are in medical school. If you cannot read the syllabus and figure out, oh, I need to read these pages because she says these are the pages on this week, you should not be in medical school. I'm not being mean, but I'm not your mother.
Doctor, can I ask you a question?
Yes, what is the question? This is the last question, guys. I've got to go. I have other commitments right now this morning. Okay?
Last night, me and my classmates, we were having a conversation about the certain time we have to spend in the room to get infected by coronavirus. And some classmates say we have to be in the room for 10 minutes, and some of them say 15 minutes. Can you tell me what is the certain time?
I can tell you what the CDC has put a guideline for. The CDC has now said that anything longer than 15 minutes, 1-5, humstash, okay? Anything longer than 15 minutes is you are potential for exposure. That is with a mask, that is without a mask. It's just 15 minutes. If you're in a closed room with somebody, that's the exposure risk. Excellent question, because all kept changing and it depending on what you're doing. So what they tried to do was, instead of saying if they're talking, if they're exercising, if they're doing this, if they're doing that, they just kind of tried to put everything together and make a simple rule. And the simple rule is basically anything longer than 15 minutes is considered an exposure.
Yes. Okay, thank you.
You're welcome. Okay, guys, I am
Teacher,
sorry.
I will ask you some question, please. Tomorrow you will open a live like yesterday?
No, I won't tomorrow. I do those on Mondays, or that's what I was trying to show you on my syllabus. But you are always welcome to send me an email, ask me a question. But the live stuff is just, you can ask me questions on, or my office hours are posted. So I'm on here. So let's say you're looking at this weekend and before we have class, you want to ask me something, just send me an email.
Okay, tamam.
Okay. Otherwise, office hours, I am on live. And you can wait. If it's something not important and you just want to discuss something, come on in office hours and let's talk about it.
Okay, thanks.
I have all the time then to have a longer discussion.
Thank you.
Okay. Guys, it's time to go. I appreciate all the questions. Hopefully that's addressed most of them. And in probably about 15 or 20 minutes, the video should post into the link. It does it automatically. Like I said, it just takes time for it to process everything. Okay? I'm going to close everybody down. Have a lovely rest of your Wednesday.
Thanks.
Thank you.
You're welcome.
Have a nice day, Doctor.
Bye.
Goodbye.
Bye.
Goodbye.
Come on.